Welcome, everyone. You are here to learn about the Culturally Responsive Measurement Tool, or the CRMT-PF. So this is an information session. I will share a little bit of information about the tool and then open it up to your questions and see if there's anything else you'd like to know about the tool. So this is our agenda. We will have a little bit of an icebreaker, and then we'll talk about what are the protective factors, talk a little bit about the project background, and we'll talk about the CRMT, how it's structured, and how you may want to use it, and what the next steps are if you want to get started on that. So first, just a quick introduction. I am Meredith Williams. I'm the Director of Operations for the Capacity Collective, and I've been working on this for about 4 years. I'm currently in Grand Rapids. And I have a picture up here of Em, my wonderful colleague. Em passed away, but Em was so central to this project for the last 4 years that we couldn't have a slide introducing without including Em, whom we missed very much. So now a little bit from you. I would love to know, and feel free, you can put this in the chat, or if you want to unmute for a moment, think about the program. If you are a person working in a program, how are you currently assessing any sort of increase in social connection? So I know for a lot of programs, that's a measure that you look at is this person becoming more connected to community geographically or culturally? Do you have a way of measuring that in your program? Again, feel free to use the chat or feel free to unmute. All right, so you've got ASQs, right? But they don't necessarily measure social connection, but there's social emotional learning in there. Yes, I'm not sure. Yeah. I think it's one of those things that a lot of us want to know. And that's one of the goals that I hear from a lot of programs is, yeah, we want to be able to understand if people or feel like they have a growing social connection, but are you actually measuring it? All right. Well, feel free to keep answering in the chat if you have any thoughts, but yeah, let's talk about this. So again, why do we ask you about measuring increased social connection? Well, because the tool we're going to talk about is going to focus on those protective factors, and social connection is one of those protective factors. You're probably already familiar with protective factors because they are part of the evaluation framework used by BSK to assess programs, right? So you've probably heard of several of these. Protective factors fall into the better off category. So all of the measures that you've chosen for your better off reporting will probably map onto one or more of the protective factors that you're going to see in this presentation. Here's a definition of protective factors. And you'll see that it comes from the Center for the Study of Social Policy, specifically from the Strengthening Families framework. But plainly, protective factors are a strengths-based way of measuring resiliency and health in families and communities. Best Starts for Kids wants to support children in King County growing up happy, healthy, safe, and thriving. And a lot goes into that, of course. There are more protective factors in the research on family health and wellness, of course, but these are the ones that with testing we found to be the best fit for a tool like this. And that is family resilience, knowledge of parenting and child development, social supports, concrete supports, and parent and caregiver and program staff relationships. Of course, there are straightforward things that might go into your health, like access to healthcare, medication, and there are many social determinations of health, such as access to housing, access to good food, etc. And then there are these less tangible things, and that's what those protective factors are hoping to measure and to quantify. A lot of home visiting programs, early learning programs, home-based programs do a great job of strengthening these protective factors, but don't necessarily have a way of measuring it. So this offers a way to actually be able to measure those. That's where this tool comes in. So why is that important? As I mentioned earlier, many assessments that are out there are deficit-based. They really talk about risk factors, which is another way of thinking about those less easily quantifiable social determinants of health. For example, take the ACE assessment, which you have heard about or perhaps have used in your program. That's the Adverse Childhood Experiences Assessment, ACEs. The ACEs assessment looks at the connection between adverse childhood experiences and adult health outcomes. Of course, it's really important, it's crucial to acknowledge the impact of trauma, abuse, and all of those things on our health. But we know that this and other assessments that focus on all of those risk factors are disproportionately given to BIPOC communities, low-income communities, etc. And it paints a picture of our communities as being problematic or pathologized. So as we're giving those screenings and assessments, we're focusing over and over again on trauma and risks. It reduces marginalized groups like BIPOC communities and people with disabilities, immigrants and refugees, and others to these negative things, when we know that families we're working with are way more nuanced and complicated than that. We want to celebrate families, not shame them. So rather than focus on risk factors or deficits, a protective factors framework is strengths-based. It helps communities and families celebrate resiliency. And for programs, it helps you find a way to actually see that you are strengthening and reinforcing those resiliencies. Of course, we don't need to sell you all on protective factors, but honestly, you're probably already measuring them. And this tool is a great way to do that if you aren't sure that you have it measured the way that's actually helpful for you to understand your impact. All right, let's talk a little bit about the background of this project. It started when BSK started getting a lot of feedback from programs like yours, including some of the programs that are represented here on the call today, like at Open Arms. They were getting a lot of feedback at BSK that the assessments that were being used weren't always a good fit for the families they were working with. They weren't culturally relevant. They were maybe only in English, maybe Spanish sometimes, and a lot of them were really focused on risk factors. So King County launched this project with a few goals. First, develop a tool that is culturally relative or culturally relevant and can be translated into various languages. It needed to measure protective factors and ideally for families with children under the age of 5. Second, they wanted a tool that could support the research on the effectiveness of all of these amazing community design programs that were being designed, like a lot of the programs that are here, right? And they also wanted to demonstrate it is possible to do something like this, to actually have a community-driven tool that's built in the community and centered in community, even when you're working on a big initiative like BSK. It is possible for a government entity to be involved in a community program like this. King County asked us to focus on key communities that are working and living in King County. So specifically Black and African American families, Indigenous families, Hispanic Latino families, you see this list here. And that also includes families of children with special needs or disabilities. So these were the communities that the tool was built around and tested with and tested in. So let's talk more about the tool itself. 4 years into this project, we have a tool that we're really proud of and we're really excited about. But I'll actually open it up to questions. Any questions so far about the background or reasoning for this tool existing? All right. Well, definitely, by all means, if I don't see the chat, my wonderful colleague Jen is here to respond to comments as needed. So absolutely let us know if you have any questions. Okay. Link in the chat to the tool itself. Yeah, we could send you, I think probably the best source right away would be the BSK blog. Yeah, there you go. Lisette is here from BSK and will be rocking the chat with the links. There you go. All right. All right, the CRMT-PF has 22 questions. I'm sorry?
Sorry, I just want to interrupt. There was a question. about, could you share an example of when the tool has been applied?
Great question. Yeah, so we did testing so we've probably tested it several hundreds of times in different communities across King County. And so I would say a good example is an organization that works with kids in out-of-home care. And they used the tool as sort of a needs assessment when they were starting with new families to understand where they were and where there might be opportunities to give resources or referrals. And so they gave it one time at entry into the program, and then they gave it later, at least 6 months into the program, to see if there had been any change over time. So that is so it's all been early learning so far, and it's been several programs that are, like out of home care, foster families, things like that. And then there have just been other early learning programs that have started to use it. Is that for Cindy? Is there anything else specifically I can help with that, or I can answer?
No, thank you for sharing. That.
Yeah, great. And yeah, I think what was really great too is with specifically that program with the out-of-home care, we were able to test it in Spanish, and that was felt like a good fit for families in that program. Awesome. Thank you so much for the question. All right, so the CRMT-PF, it has 22 questions. Since protective factors are complex, because life is complex, each protective factor is actually measured with 4 or 5 questions. So it isn't one question for one protective factor, since it's so much more nuanced than that. So it's 4 to 5 multiple choice questions, and then they're grouped together by the protective factors that that they measure. So you can mix and match, meaning you can include the sections that you need, but you can exclude sections that you wouldn't need for your program. So it's highly adaptable in that way. Again, it's multiple choice, so you can give it interview style in conversation with staff, or you can send it to participants to have them fill out on paper or electronically. You can give it one time. We heard a lot in testing that it was a great conversation starter, or you could give it at beginning of service and later in service to be able to see change over time. That's where you can see that ideally change in social connection, or change in concrete supports, or change in knowledge of child development, right? Those are the things that a lot of our programs do. So ideally, it can be used in those ways. So it is highly adaptable. And it really is crucial to note that the CRMT was adapted, tested, modified with a lot of feedback from many, many community partners and families all over King County. And some of you are in this room, so thank you for being here, and would love to hear about your experience too, if you'd like. So we've done this for about 4 years to really ensure that this tool is as culturally responsive as you can be, given that there will never be one tool that meets all the needs of all communities. That's impossible, right? But a tool that has been tested to work fairly well and consistently with families in King County. All right. So this is what the CRMT looks like right now if you were to administer it on paper, right? This is our paper version. The first page has questions 1 through 14, and it covers 3 of the protective factors. Family resilience is that section with questions 1 to 5. Knowledge of parenting and child development is questions 6 through 9. And social supports are questions 10 through 14. There's also a script at the top introducing the tool. In testing, we found that how you frame the tool, how you explain to families what the instrument is and why you're using it, makes a big difference on how helpful the data can be. The second page starts with another bit of a script to explain the next section. It gives you the language for explaining the concrete support section, which is right below that, since that's a little unique. And then concrete supports are mentioned with measured with 15 through 18. Another little bit of framing for that last section. And then you'll see that there's this caregiver practitioner relationship at the bottom. That section you use after you have had a relationship with the family. So you wouldn't necessarily use that section the first time that you meet with somebody because they haven't had a relationship with you necessarily to be able to answer those questions. But you use that at the second time that you give it or another time that you've given it. If you only give it one time, but it's at the end of service, you could use those questions, but you'll just want to actually have a relationship to be able to ask people about. Then the third page has a short script of explanation and then some questions to ask about the participant themselves. If you're giving the tool anonymously, you won't know the demographics of the person taking it. So if you want to give the tool and understand how your program is doing in general, you'll want to ask some demographic questions to be able to say, okay, look, our program seems to be working well for this group, but not that group. Or it seems like maybe we need to do a little bit more outreach with one group over another group, something like that. So if you're giving it anonymously, you'll want to choose what demographic questions to ask. But if you are connecting it to someone's actual information, you can skip all of this because you will probably have the demographics and other information about them, your families, in your intake package or whatever you do. Finally, there's this optional page at the end. It's for program information, and it's also space for the person conducting the interview to make some reflections. It's not a client facing, it's only for internal use, but it does help, again, to try to understand your data with more nuance than just like, here's what these numbers are. It gives you a way to look at your program in general and make some comparisons between groups.
Here's a question, Meredith, in the chat about how these questionnaires are complemented or not by the ASQ, and if it's common to implement both and at the same period of time.
Yeah, great questions. I think what is complementary about it is that the ASQ is, of course, about like the stages of development, but it's about the infant and the infant's development or the small child, but it isn't about the family around it and the support system. So it's a little bit broader, which I think is really nice because there's, of course, developmental screenings are so great and so important. Then it gives you a chance to step back and say, okay, this is how the kid is developing, but in what circumstances? What is the context around the kid? So I think it is great to do them around the same time, meaning when you're taking the baseline, like, okay, this, I'm getting to know the family. But then again, after like 6 months or a year, you'll probably do ASQs based on the age of the child. You'll do your 18-month and all of that. But this you would do, okay, you've been in our program. We've spent about 12 hours together. Now let's take this assessment again and see, are your social supports increasing? Are your concrete supports? Has there been a change there? I'd say they're different enough that hopefully they work together in complementary ways. Thanks for all the good questions.
Thank you, but I think they complement each other. Because when you do the ASQ, we have learned that we need to have a better connection with the families in order to have more accurate results. You know, so we're more trustful for them. But thank you. You answer my question.
Great. And I really love your point that for you to really ask anything, including developmental screenings like the ASQ, you have to have a trusting relationship. And so when we show this tool to programs, we say, you really have to look at it along with everything else you ask and ask, is it going to contribute to the trusting relationship or is it going to take away from a trusting relationship? And a lot of the script in there is there for that reason. So that you can explain, this is why I'm asking, this is what I'm going to do with the information. So it doesn't just feel like extraction. And I'm going to take more information from you. I'm going to probe in there and ask these really hard questions. It's not about that. It's about understanding and building trust and all of that and gaining context information about the family. So I appreciate your questions and thinking about this. It's great. Thank you. All right, apparently I can scroll the right way. All right. The CRMT is currently available in 3 languages. So we created and tested it in English, and then we have a version that is in Spanish and simplified Chinese. The Somali version is in progress, and also a Vietnamese version is in progress. And if you are working in a program that could use either the Vietnamese or the Somali version, let's talk, because we might love to have you as a community partner for pushing us to the end of that and getting those translated and tested so that they can be out there in the community. All right, so let's talk about some of the resources that we've developed to support you in using the CRMT. And I have a little bit of a list here, but I'll talk about each of them briefly. First is an implementation guide. Right, so that's long, it's big, it's everything you could want to know about. Oh, sorry, there's a question, can we add the Arabic language? It is not yet in Arabic, but if there is a need for it, we should absolutely talk about that. So we should follow up after the call and talk about the possibilities there. Yes, the implementation guide is everything you might want to know. How has it been tested? How has it been validated? What are all of the little details that I need to know to make sure that I put it in my data system correctly? It's sort of everything you could need to know, the big guide for how to use the tool and how to use it well and use the data, score it, all of that good stuff. It's good and intense and we love it, but if you're not ready to read all of that yet, we also have a quick guide. So it's a quick guide that just gives you a sort of at a glance version, which might be a good place to start if you're just trying to decide, is this a good fit? Is this something that we might use in our program? You could take a look at the quick guide and get some ideas for, okay, yes, we're ready for that. Or no, there are a couple of things that we would want to put in place first before we implemented a new tool or something like that. We also have created a few handouts to support this. And you can share them with your organization, you can share them with staff, you can share them with your families and get their buy-in, because of course it's always better to have decisions come together and not just we're doing this to families, but we're doing this with families, right? So these handouts could give you an opportunity to talk to your families about this. And you can see there are several. There's an overview of what is it. There's a handout explaining what are protective factors. There's some frequently asked questions and a quick guide or overview on how to score the tool. We've also created a scoring calculator. It's an Excel workbook that you can download. And if you're giving this survey on paper, you can use it to calculate the scores and do some of the analysis, track people over time, so that you can, really see how not just one family is doing, but how all of your families are doing as your caseload or as a program. And it does the scoring for you, which is nice. And then very soon, they're so close, we're in the final editing phases of 4 training videos. And so those should be on the BSK YouTube soon. And there will be a link from the BSK blog when those are launched as well. There are 4 videos. One is just an introduction to what the tool is. One, the sort of quick guide version of how to administer the survey, like what you'll need to know, how to score it. And then once you have those scores, how you can actually use the data. So those videos are coming very soon. All right, any other questions or thoughts or anything before we talk about implementing the tool? Yeah, thank you, Lisette. Lisette put a link to where you'll be able to find those videos when they're out. And the other resources are there as well. All right, we're a little biased, but it is worth saying the CRMT may not meet the needs of every organization. I mean, of course not, right? Again, to make a one-size-fits-all tool, it is not really possible. But as we mentioned, it is modular and it's flexible. And we're really hoping that you can find a way to find some use out of some part of it if it's helpful for your organization. And if you still have questions after this session, just so you know, we will have a training later. It's going to be in December. I'll share the information about that in a minute. And I will also say that there is free implementation support for all BSK funded programs. And we'll talk about that at the end of this presentation as well. So if you are thinking about implementing the instrument, you definitely don't have to do it alone. We are here with some supports. All right. So who should use the CRMT-PF? The program is, or the tool is best suited for programs that offer repeated services for a family or caregiver. You can administer it once, but we recommend that you use it over time so that you can see change over time. And you'll want to spend at least 12 hours in service with the family before you give it a second time. So if you're only going to see them one time, absolutely you can still use it. But you'd have to think about how useful the information will be if you aren't able, if you are seeing the family one time. Ideally, also, it's for programs who are actually trying to make changes to those protective factors. If you know that one of the goals of your program is to increase social connection, great, that is a great fit for you. And maybe you need that section, maybe you need all of the sections, but really think through the goals of your program, and then you can decide, does this help us achieve our goals? And so keeping in mind that, of course, you can use it as modules. You don't have to do all the sections, you could do some of the sections. It's also a good fit for families. Oh, I was going to say that if you serve pregnant folks, the survey may have to be adapted just a little bit to make sense, but you can make some adaptations as you need to make it work, right? So it's a good fit for programs that really want to have an idea of how their families are doing with those protective factors. If you want to know how people are doing with their concrete supports and their social supports and their knowledge of family and child development, it's a great fit. And for programs that offer those, again, those repeated services. So if you work with people over time, it's a great way to measure change over time. All right, we'll get into a lot more detail on the implementation if you come to the training in December. And Lisette put a link in the chat for registering for that if you're interested. But we do want to share a little bit of an overview so you can think about the feasibility, make educated decisions about how you might use the tool. These are all decisions you'll have to make. We don't have to talk about all of them today since we just have the hour, but I will just talk about the first couple bullet points here. The most important being, think about your data goals. That's going to be primary for making your decision of, do you want to implement this tool and how? So think about, these are the 5 protective factors you could measure. Does your program want to impact any of those? Would it be meaningful to see change over time? Would that help you demonstrate your impact? Would it help you tell the story of the work that you do? When you know what you're trying to achieve with the data, it helps you decide how best to implement it, how frequently to do it, at the timing at which you do it. All of that can be linked to your goals. For example, maybe what you need is a snapshot. This is where people are at the moment with their protective factors when they join our program. Great. Again, we got a lot of feedback that this is a great needs assessment. It's a great conversation starter. It helps give you an idea of, okay, here's some referrals, here's some resources I can provide right out of the gate, right? So you could do it one time, or you could use it as a baseline to see what happens after that. If your data goal is to measure the impact of your program to see if you are making a difference, you will use the tool accordingly, right? So you'd use it differently. Rather than using it one time, you'll use it at least 2 times with some amount of time in between so that you can see, here's where they were when they came into the program, here's where they are now. And if you need to report on protective factors for your VSK reporting, great. You can use the tool to be able to do that. Once you have your data goals, you can make the rest of the decisions that you need to make to use the tool. There are quite a few things that you'll have to figure out. And again, we can help you with that. There's all of the resources And there's the capacity building supports that I'll talk about. And we also have an implementation checklist, which we'll send you after the session. So you can just kind of go point by point and go, okay, can we do this? And what do we need to do to make it happen? All right. Any questions at this point? All right. Let's talk next steps. There's several possible next steps, so we'll talk about each briefly. First, we do have the print materials that we talked about. So those handouts and those resources, it may be helpful to see some of those documents just to get a feel for the tool and if it will be helpful to you. There's all sorts of resources available on the BSK blog. There's a page for the CRMT-PF in the BSK blog. So if you'd like, you can use your camera on your phone to scan the QR code, and this will take you to the BSK blog, or Lisette can put a link in the chat if that is easier. So I'm going to give you a few QR codes if they're helpful, but you'll also have the option to grab them in the chat. Again, if you want to see what all the documents and resources are, that will take you there. Oops. Okay, good. Trigger. All right. All right, and another next step is you could attend the training if you want to spend more time talking about this in much more detail and how to actually implement it and make the decisions, get it into your data system a little bit deeper. You can come to the training. It's being held on December 3rd from 9 to 11. You can register at the link that's in the chat, or you can use the QR code here, and we'll definitely get into more depth there. You can also get free implementation support. And this is where, if you are a BSK funded organization, and I do mean organization, even if your program that you want to use this in isn't BSK funded, as long as you receive funding from BSK anywhere in your organization, you are eligible to receive free support implementing this tool. Whether that's you just need a thought partner and you just want to go, is it worth it? Is it not? How does this overlap with what we're doing? Does this add any benefit? Just even those conversations, we can support that. Or if you're like, okay, we have Charity Tracker, or we have Apricot, or we have Airtable, or something like that, and we don't know how to make it work, we can help with that part too. You just have to, you can email me. You can, my email is in the chat. You can use this QR code to send me an email. You can go to your program manager at King County and say, hey, I want to work with the Capacity Collective to implement this instrument. Any route you go to, we can make that happen for you. It is getting close to the end of the year, and so we don't know if we're going to be able to do it in 2025. So if you do want to at least have the conversations now in 2024, we'd love to hear from you soon, so we can talk about that. And then you can get involved. If this is interesting to you and you would like to, for example, work on a tool in Arabic, or if you'd like to support the efforts to finalize the Somali tool or the Vietnamese tool, we'd love to have community partners keep this a really community-centered project. So if you want to attend the training, if you want to get free support, if you want to access any more of these materials, or if you want to become a partner in any of these, including if you have an idea for an organization that might be a good fit as a partner, we'd love to hear from you. So this specific code is to an interest form to get on a mailing list. We're not going to like spam you with emails, but just to get yourself on the interest list of people who want to know a little bit more about this. And then we can follow up, and we'd love to have you as a partner. So again, there's a link in the chat. All right. What questions? Questions about choosing it, questions about using it. I mean, the nitty-gritty of scoring may not be the most exciting topic, but if you have some questions about scoring, bring them on. So any questions from our group here?
I would like to use it, but I need more information about it. So I already registered for December 3rd and see how we can take advantage of it.
Yeah, great. I would love to talk. If you are comfortable sending me an email, we can also
Oh, great.
bounce
Okay.
around ideas or anything anytime.
Thank you.
Yeah, sure.
I could see it. I'm a teacher on the Birth to 3 team, and I could see it also being valuable for FRCs to use, family resource coordinators with families. Possibly, I mean, I don't know the tool yet, but to find out exactly what kind of supports they might need. So,
Yeah.
yeah.
I like that it's to me, it's a balance of, you know, this is a snapshot of how you're doing with family resiliency. This is, you know, where some parenting classes or resources might be helpful, but also it's very much like, what are you able to afford and not afford? And then whether or not you offer those services, it gives you information that you can, it gives you an opportunity. Here are some resources, here's a referral to housing support. It really gives a robust look at family stressors while also having a lot of questions about those positives about we're celebrating together as a family. We work through things together as a family. Yeah, and we haven't tested as extensively with families with older kids, but based on all of the research that we've done, we do think that it will work with families with older children. We just haven't done the same amount of testing. So if you want to use it for birth or 3, but then you're also thinking about programs for older children, I think it's a viable option. Thank you so much for taking the time to be here and learn about the tool. We're excited to work with y'all. Bye. Thank you.